So to our panelists, as we think about the populations that we serve or that we're trying to reach, are there particular populations right now, while we're in the middle of a pandemic and in the middle of an enormous emotional outpouring over the great loss of Mr. Floyd, are there populations we should be focusing our attention on right now when it comes to behavioral health? And, you know, are there some populations more at risk than others? So I'll open it up to the panelists.
Hi, Jenny. I'm happy to talk a little bit. I think there are a lot of different populations, but certainly my experience right now is with the healthcare workforce and also the Philadelphia community. And I will say that it's been interesting watching from kind of a psychological community perspective, the different stages. So typically there's sort of a heroic stage at the beginning of a disaster where everyone has a lot of energy and pulls together and feels part of a team. And then there's a disillusionment phase that I think I'm seeing among healthcare workers, where there's a lot of emotional exhaustion and trauma symptoms coming out right now. And you know, I think the way to support people is really focusing on both treatment, but also community and self-care and connection, because a lot of people are feeling very isolated and alone, even if they're in a hospital working with other people.
Other thoughts about that? Are there other populations we should be focused on?
Yeah, absolutely. And for me, the first thing that comes to mind is the rise in domestic violence and child abuse that we're almost certain to see during this time. So making sure that organizations are thinking about how do we help report that? How do we help people feel empowered to report child abuse in their own settings? Another really important tip that I would like to pass along is to make sure that you're checking in on your staff members, and not just through text or email. Really what's been shown to work most effectively is to do it by voice. So whether that's Zoom like we are now or a phone call, to make sure that you're checking in at least once a week with each member of your team. And finally, as far as populations go, you know, we're certainly working with first responder and military community who first responders now we know are facing a lot. They have additional stressors, not just of working long hours now, but are often seen as the enemy. And when you are maybe potentially identified as a change maker in those organizations, that can be incredibly deflating and demoralizing. So how do we help and at least give them the resources and tools so that those change makers that are in those organizations can continue to do the work that they are to change these organizations to make them better for our whole community? That's a lot of what our goal is here, is to support those communities.
So, yes, Varun?
I was just going to actually point out also that in the recent years, we have had a significant uptick in suicide in general, to the point where it is now at an epidemic level. And healthcare workers in general are at a much higher rate of risk than the general population is. So looking at not only our frontline workers, but our healthcare professionals in general, to make sure that they've got the resources that they need, that they've got the voice they need in order to really combat some of the significantly high burnout rates that we've had. I think on average, we lose a physician a day to suicide.
Wow, that's a really sobering statistic. Wow. So as you think about these populations that you've all mentioned, all of which are critically important, at a time where we're not able to physically get together, how can we use technology to connect with each other, to help people practice? I think, Cecilia, you talked about self-care. You know, what can we do, or what types of tools and technology are out there that we can share so that people can reach out and connect and get the help that they need?
So I can certainly talk about what we do here at NeuroFlow. I think it's all about culture in a workplace, and we have our weekly happy hours where we're getting together on Zoom and often playing some sort of games. So we use a lot of Jackbox games. I'm not getting any money from them from dropping their name, but just finding ways to get together and normalize the relationships again, right? And it felt very forced over Zoom originally, but the more we get together and the more we kind of try to play games and speak with each other, the more those walls have felt like they've broken down and we're able to kind of feel a little bit of sense of normalcy, at least for that short period of time.
In Varun, you had, oh, I'm sorry, go ahead, Cecilia.
Oh, I was just going to say, speaking from sort of a clinical perspective, we've had to really transform the way we deliver care and use telehealth, you know, a lot more widely. And I think that's probably one of the silver linings of COVID is the expansion and the decrease in restrictions. But with the caveat that some of our community, you know, has a difficult time with Wi-Fi access, with their data plans or not having phones at all. And so really trying to think creatively about how we can make sure that everyone can stay connected, you know, supplying people with phones, thinking of, you know, free Wi-Fi, things like that. And I think in whatever organization you're in, really understanding the different burdens that different individuals have, whether that's, you know, technology issues or childcare issues or other things. I think everyone is sort of going through this a little bit differently, and understanding that variety is important.
Varun, I was going to ask you, you highlighted a lot of free webinars and resources that Magellan has on a weekly basis. How do you get the word out that they're available and that people can access those resources?
We've got a whole external communications team that really emphasizes that particular point. They really try to get that word out and make sure that everyone knows what resources there are. And Magellan has been actively putting together things on a weekly basis, whether it be webinars or Q&A type things, or any kind of resource guide for individuals that need it. Most of it is posted on the website, but our marketing team has also been going out and letting the larger organizations, national organizations, know that we've got these resources, and we're willing to be there and willing to help.
Great, thank you. We have a question in the chat around technology. So you've all described technology tools that you all are using to help deliver care, improve access, improve the quality of care and the outcomes. From each of your perspectives, are there gaps in the technology? If you were king or queen of the world, what additional technologies would you want to be able to deploy to help further the care of the patients that you work with?
I think we've mentioned the fact that we need universal broadband. So having cloud-based cities where you've got broadband for everybody, if we could have that on a national scale where nobody has any kind of limitations in the sense of being in a rural area where there is no broadband at all, that'd be wonderful, because then we can really tailor a lot of these digital solutions to specific populations, knowing that everybody can access whatever we've put out there.
Yeah, for me, it's always about connecting the dots, right? It's about connecting these systems together in a way where everyone understands what's going on and gets that full picture. So let me give you a quick example. The Department of Veteran Affairs has put out so many fabulous mobile apps. They're based on evidence, they work, they've been studied, but none of that feeds back to a care team. So it just lives in silo. And additionally, if I have more than one condition, now all of a sudden I need more than one app. So, you know, what I would like to see is that we use this tech that already exists, where we can have patients feeding information to the providers then able back to feed it to the patients, where it's feeding into the EHR, where that's then being pulled into the HIE, right? Where we're using that now, being able to pull that into big data and be able to use that information, not just for that patient insight, but now we're using that much larger power in order to gain population health insights. So to me, it's the power and the engines there. We just haven't connected the dots in a way where it's been most effective.
And I would say that the patients that really keep me up at night are the ones that fall off the grid. And so for me, it's that ability to monitor patients, whether that's digital phenotyping in order to see when people, stop using social media as much or post certain things, or whether that's biomarkers or genetics or feeding, kind of what Matt was saying, but from more of a proactive approach of connecting all the dots early on to really see when someone's starting to struggle so you can intervene early, because often by the time someone is in crisis, they've dropped off their apps and their care, and they've disconnected. And so that I think is an area where technology can really improve things.
Thank you for that. And you all are king and queens for the day, so you do get your wishes for today, hopefully. Cecilia, just to build off of what you were just talking about in terms of connecting the dots, we have a question around the data that you get every morning to triage patients. And the question is around, is that for existing patients or just new patients? And how, what additional information is changing for existing patients?
That's a great question. So every day it's for every patient, new and existing, and it's really using that natural language processing, looking at all of the text in the notes. And this is what I was talking about earlier, is the discrete data really didn't give us a lot of signal, and we really had to go to the notes themselves to find these words that indicated that someone was struggling. And so we're running that algorithm and also feeding back into that algorithm so that it learns sort of every day. And if we see that an existing patient has a new concern or a flag that comes up, then we go and see that existing patient. If it's a new patient, then we do the same thing.
That's great. Thank you so much for that. So as we think, as I usually say, in the time of COVID, there's been a lot of dramatic changes, right? So we're all getting used to using video conferencing, be it Zoom, Skype, whatever. We're used to interacting with patients, and as a clinician, diagnosing patients. I've heard some great stories of diagnosing people's appendicitis via telemedicine. What do you think telemedicine will look like post-pandemic, or what do you wish that telemedicine would look like post-pandemic, right? So we've had, broadening of access, we've had increased use. I mean, for independents, we've seen a 3,000% increase in the use of behavioral health telemedicine just in the last, 60 days or so. So what do you, and we've also seen relaxation of what were sometimes very restrictive requirements around the types of telemedicine platforms that can be used, right? So now it's acceptable to just use your phone to FaceTime your doctor. Post-pandemic, what do you see that looking like, or what would you wish that to look like?
Ginny, I would look like it does now, where they make it permanent. The restrictions are gone. The regulations that have been barriers will be gone. I've been practicing telepsychiatry since 2006, and I've seen the industry grow and explode. But the hindrance of full growth and mainstream acceptance was always all of the requirements, restrictions, and regulations around it. Now that that's relaxed, I think that's the reason why you're seeing such a huge interest in telehealth and mainstream acceptance of it.
Thank you.
Go
ahead, Cecilia.
I was just going to say, for me, I think it's, I completely agree. And I think it's really about patient preference. I mean, I want those people who feel comfortable using telehealth and enjoy it to use it. If someone wants to come in and see me, I want them to be able to do that as well. And it's not always the people you suspect. Just last week, I had a patient who had missed the last 6 appointments and had housing insecurity and has schizophrenia. And I called him up on FaceTime, and he was like, "Hey doc, haven't talked to you in a while." And we had our appointment, and I was like, wow, this is terrific.
Yeah, and I would just add, I think there's a lot of great advances in things like e-visits, where, very routine visits that maybe I don't need to go to the office for. I know what a UTI feels like, can you just call that into my pharmacy? And remote patient monitoring as well. So the more we can be able to track patients over time and be able to identify these symptoms or deterioration of symptoms earlier, the better it'll be for everybody. So how do we incentivize more of that? And I think value-based care is certainly one way to do that. But the more we're monitoring those patients over time and earlier identification, it'll only help everybody.
Great, oh, go ahead.
No, I was just saying I completely agree.
Great, thank you. So I think we touched on this a little bit earlier, and I think, you know, Cecilia, you went very nicely through the various stages that we're going through from the impact of COVID. We've now had another, you know, massive impact from the activities recently that's, you know, impacting our nation's psyche, you know, and how we're responding. How do we help our communities, right? So how do we help our patients, but how do we help our communities to heal from this this double impact that we're having right now, we're living through right now?
To me, it's listening. You know, I was always told growing up, you have two ears and one mouth for a reason, right? So I think we all need to do a better job listening and hearing each other, understanding what a struggle means to different people. That's what I'm trying to do. That's my goal.
I think as a nation, we need to really understand how big of an impact this has been for the minority communities. I mean, first you had COVID, which was really decimating those minority communities. And then on top of that, you have this event. So part of it is we really have to get to a point where we can truly empathize with what's going on with them. We can't live the way they've lived. We haven't been in their shoes, but let's try to put ourselves in their position and try to understand the world that they live in order to help equalize the situation. If you look at healthcare inequities, social determinants of health, oftentimes mostly affect more the minority communities than it does the general population. So how do we incorporate social determinants of health into everything that we do in healthcare? Those are going to be the first steps, because in order to really help them generally with healthcare, with everything else, we've got to take into consideration all of those social determinants that play such a huge role, and that we're not going to be able to make any meaningful shifts in healthcare data unless we're addressing the whole big picture.
Yeah, to me, also, I agree with both of them, and also think it's really important to be able to acknowledge and hold the emotions, the anger, the frustration, the uncertainty and fear that everyone's feeling from COVID, from the civil unrest, from, you know, a lot of from job losses that are going on in the country, and not to say that, you know, we need to sweep these things under the rug or that we shouldn't be feeling these things, but really, you know, as Matt said, listen to people, acknowledge what they're feeling, and tolerate the emotions.
Great, thank you so much. Looks like we have a couple questions in the Q&A section. I'll see if we can address some of them in our remaining couple minutes. There's a question, you know, thanking the panelists for a wonderful discussion, asking what treatments besides getting proper medication are available there? Are there alternative ways, meditations, physical activities? So any suggestions from our panelists?
Yeah, I would say a huge range of things you can do, from medication to psychotherapy to physical activity has been shown again and again to have a huge impact on mental health. Things like meditation, things like you know, group work and social connections, and self-care. There's a whole range, and that's why I think all of these different kind of interventions and platforms and technologies and human components all kind of work together to help people. I think thinking of mental health a little bit like physical health, where, you know, even if you're completely healthy, it's good to go for a run every day. Even if you feel really well, it's important to be building resilience and to be taking care of your mental health as well.
Great,
I'm going to
thank
step in
you.
and just wrap up here. I really want to thank all of our speakers and panelists, Ginny, Varun, Cecilia, and Matt, for taking the time this morning to share your expertise and wisdom around behavioral health, mental health. As I said on the outset, it is with heavy heart that we deliver this program, but recognizing the importance of behavioral health, I would encourage all participating, recognize and reach out for yourself to resources, to your friends, to your family for resources. We've recorded this session. We'll share that. We will share the slides and follow up with the Q&A. Again, I want to thank Independence Blue Cross and Capgemini for their support of this important topic and effort, and also encourage all participants to look out for our survey on this program to help us optimize and improve for future programs and our upcoming events. At PACT, as I said, we thought long and hard about canceling and rescheduling this. Given the topic, we thought it was important to share, but we are pausing additional PACT messages and any business as usual in observance of Blackout Tuesday for the rest of today. I wish you all a good day, encourage you to vote, and again, once again, thank everybody for your participation.